Welcome, my dear audience and friends, to another segment of our Women's Month interview series, where we are pleased to invite to discuss with us global innovators in the AI and digital health space who are doing phenomenal work in women's health. In this episode, we are delighted to host another special person who is an amazing young lady doing phenomenal work in women's healthcare, especially to do with breast cancer. Now, she is the founder of a mobile app that is actually designed to ensure that women take care of their breast health and make timely and informed decisions, before they go out there to be able to seek aftercare and treatment. So therefore, without spilling too much of the beans, I am pleased to welcome my dear sister from across the pond, Dr. Mercy Ofuya. Thank you ever so much, Mercy, for coming on the show. You're so welcome.
Thank you, Grace. Thank you so much for having me. It's truly an honor to be on your show. I've watched the work you've been doing, and it's really great. And just want to say thank you for the opportunity to be a part of your own journey and story as well. Thank you.
No, we are more honored. Thank you too. So, with your background as a medical research and a biostatistician, how do you think that has shaped your focus in women's health?
Thank you. So in terms of how I even got into this whole journey, I think the first thing I always often tell people is my career has not been linear, and it's my focus on medical. Well, my background is in medical statistics, and my focus was been, of course, medical research. And though some of my personal interests have always been women's and child health, but that said, most of my work has actually been in methodology, broadly speaking. And for a few years before starting Copperise, I had the opportunity to work in cancer research. And at that time, I was mostly I was becoming familiar, with US and UK, European data in terms of the stats and all that. And then it got to a point after a few years, I then, decided to take a career break for personal reasons. And that was a really difficult decision at that time. But then it then gave me the room to think. I became more conversant with sort of the social media world and all that bits and bobs. And then it was during that time that, very sadly, someone close to my family, called my friend, passed away due to cancer. Not breast cancer, a different kind of cancer. And then at that time, it was like, I started thinking about, other people I'd known who had also passed away very sadly due to cancer, so who were close. It just sort of came more familiar to me in that sense. And then I noticed a pattern that a lot of them had been diagnosed, a lot of them had passed away rather, just within a year of when they were diagnosed. Mm-hmm. And one of my specialties is systematic reviews. So I went on the PubMed and other databases and started searching out publications on late detection in Africa, in Nigeria. I was just curious, in terms of, and then that was when I then noticed that most breast cancer patients were being diagnosed, or in fact they were presenting at very late stage in those low income settings, particularly in Nigeria and sub-Saharan Africa. Mm-hmm. And that sort of piqued my interest. And that's when, I decided to sort of then start thinking, how do I use all the skills I had acquired over time to solve the problem? And then I started speaking with friends. Some of my friends came on as volunteers. And I mean, we didn't really start thinking, we were just thinking we're just going to work on a project. Melinda French Gates was speaking, and then she was talking about how nonprofits can learn from Coca-Cola, and how however remote a village is, you would always find a bottle of Coca-Cola. Mm-hmm. And then that night, as I put my daughter to bed, I started asking myself, so what is that one tool that every woman has access to, no matter how remote, and no matter how, even if they don't have basic resources like water or power supply. Mm-hmm. And I said, everyone, and I'd volunteered in past in very rural parts of Nigeria. One thing I noticed, but they would always have a basic mobile phone, at least one household, or they're linked to one. So I thought, okay, well, how can we use this resource that they already have access to then create awareness for breast? So that's where then the app came, the idea of the app started to form in my mind. But then I thought, I'm not a tech person. But with time I realized I didn't have to be a tech person. I just needed to find people who could actually come on board to help, and then have volunteers come on board. And people started putting, and then we did a survey. So it was a journey. Then we carried out a survey to find out how to sort of validate our idea, to see what the really problem was, and then to get a sense of what would the solution look like, because it's important to actually get input from the people you're trying to solve the problem for, as opposed to dumping some. I mean, what if it turned out it wasn't the app itself? And that's another lesson I'm learning in tech. But in terms of, that's how I sort of segued from my my background in medical statistics into that, which is still playing a huge role, because from there I learned project management. I learned how to define a problem. So those skills have really come to become very useful in what I'm doing now.
Essential, yes.
Very essential, yeah. And just to add, I think, so that's the things I did then in terms of bringing together stakeholders to collaborate on finding solutions to a problem. Some of the skills I'm actually using now to,
That's wonderful. And especially when they're not opportuned to know too much about cancer and early detection and all that, because it has not happened to them, except it has happened to you or to someone close to you that is, conversant with these things. They don't know.
Give people, I'm going to use the word grace in that sense. Yeah, because it's what they've been fed. So trying to change learned behavior, it's sort of it's
a gradual thing, actually.
It's very gradual, very gradual.
It's a gradual thing, but sometimes one has to show tough love to put it across to them.
Yeah, particularly in those settings, and I'm also learning that getting the buy-in of the people they already have faith in. Because I mean, if myself and my team come were complete strangers, and then also understanding the context and respecting and appreciating that, because that is very vital, and then understanding their language in terms of how they think and what would resonate with them, and trying to present the message in that light. So
that's wonderful. So what with this early detection app, let's call it the early detection app, which is called Mami, isn't it?
Mami, yeah, Mami.
Yes. For me, I'm calling it Mami. That's the African part of me, and I love it. I'm putting that intonation there.
Because so Mami stands for mother, and very affectionate, and also it's also sort of short form for mammary gland at the same time. So we felt we were very deliberate about the name.
It's really nice, and it's synonymous with mother, with care, with love,
with care,
and support, and which is what you're bringing crucial to bear. Yes. So for anyone, like I hold that app, I have access to that app on my phone. Now, what would you be saying to me?
Okay, so interesting. So the way Mami works is so Mami essentially, it's a mobile app and that teaches women about breast cancer symptoms. So the idea is for them to become more familiar with what their breasts look and feel like. We want people to think about it from a sense of wellness, just the same way what your body temperature feels like, and when you have a fever, when you don't have a headache or not. So rather than thinking about it from, it's cancer, I'm not saying everyone will have that. That's one point. Is just know what your breasts look and feel like normally, and so based on that, if there's a change, then we then encourage the woman, strongly suggest that they then go for to first go to see a medical professional. And we're always very careful to state that Mami is not a test, it's not a diagnostic test, it's not a breast health educational tool, and just it's there to facilitate access in terms of support and information to signpost people to accessing care. So the way Mami works is when you download the app, first you can download it from both Google and Apple, Google Play Store and Apple Store, and it's free to download, it's free to use. And so the first thing you do is then set up a monthly reminder, and it's tailored to your menstrual status. So whether for those who see their periods regularly or not. And then the next step is so you set up that monthly reminder, because people often say, oh, when you say, why don't you check? Because they go for these matches, they go for campaigns, but they forget because of we're all busy, we're all very, we all get with life, and it doesn't really matter whether you have children or have children. We're all busy, we all have so many things on our plate. So that's said. So after setting up the reminder, then the next thing that the user does is then you have the opportunity to then watch a video. So there's a video there that shows you how to do a breast self-examination. Now, we ensure that the language is very simple, no medical jargon, so it's very clear. It's by a medical doctor on the app. And then that video is presently it's in 5 Nigerian major languages. It's in English, Pidgin, Yoruba, Igbo, and Hausa. And we're looking to add more Nigerian languages, as well as expand. As we expand to other countries, we will then also have language for those countries. And then another step is actually to even translate the entire app as it is into those languages. So even those texts in English will be in native language as well. And then following that, you then get to see have a look at, you see you have a follow a step-by-step guide on how to, the symptoms to check for. There are images there, and we'll be very particular in terms of the complexion of the skin used. It's tailored, it's contextual to the average African woman. So you can get to see the symptoms, what they look like. And what some of the users, early testers, said was that they wanted to be able to keep a log of their check so they can track their check. So we've made that available. So we keep iterating it. And what
tracking, that's very good.
Yeah. And so what we often say is, we're developing, Mommy is developed by you, for you. So give us feedback as you use it, and then we implement those things that, the aspects or features that people want. Then if a woman then notices a symptom or an unusual change, she then has the option to fill a form on the app, and then we then provide support with connecting to what we call navigators within the hospitals in Nigeria. So far, we made contact with about 4 navigators
that you're collaborating with.
Yes,
based on this. Yes, okay.
Yes, based on this. So, but then we're also at the same time we want to expand on that. And so far, from the way we've noticed it has been used, we've taken a step back, and we're going to we're working on changing the format. So essentially, Mommy is a living so it's
morphing, that is the good thing about it. You go forward and you come back based on your surveys, based on feedback, because you have to survive on feedback.
Even from our observation, just seeing how people use it. So we're doing that, and so we're learning. So it's that sort of like we build, implement, we learn, adapt. So that has been crucial. So that's how, in summary, Mommy work. So the idea is to really teach women, make it become conversant with them in terms of symptoms. As time goes on, we'll add more resources in terms of in terms of risk factors, and in terms of other breast health and general health tips.
Mental health, tips, those are things.
And then also connect people in terms of telehealth medicine. People want to be able to have that access to. So as we raise funds, we're just about to start launching a fundraising campaign. So as we raise funds, we'll start to implement those. So we're excited and hopeful.
I wanted to ask, for those people, as you rightly said, the one thing that most people, let's say 95% of the population have, is a phone. But at the same time, what public awareness have you done? Have you advertised this or done a campaign, a media campaign, actually public media, like on radios and television, different languages and everything, to really encapsulate everyone?
So a lot of what we've done so far has been on social media platforms. We've done a bit of advertising. We've done a few online posts. We've been featured in a few places. But that said, our next step is actually to go on radio.
I
and
think
then
that would be
possibly
wonderful.
then television, and then because we really want to spread it out, and then even we're also looking to connect with telecoms companies and try
Hmm.
there's a way to those how they advertise in Nigeria, for instance, so we want to also sort of leverage on that. And one of the challenges we had in terms of doing that has been it's sort of chicken and egg. We need more people to do it, but at the same time we need the funding to do that, to do the
Hmm.
promotion. So
Hmm.
it's part of the plans we have, and
Hmm.
we are working on it, just taking step by step.
That's wonderful because I believe that not everyone is social media motivated, to be honest.
Yes, yes,
There's
yes. So
still a lot of people that
and
say, except they have children like us or like you, that, oh,
yeah,
this is what's happening. A lot can be, but there's still some people that would stay close to their radios or to their televisions, so
yeah.
that
Yeah.
information should be
And
out
one of
there.
the things we even want to do now, and I mean, even being on your platform, such as this, we hope that people watch it, they spread the word as well.
Yes.
And one of the things we also want to do is really literally go offline, use the
Hmm.
offline approach, like take it to the people where they are, in terms of
Yes.
like
Grassroots.
universities,
Mm.
salons, where people make their hair,
Barber
markets. So
shops,
barbershop.
because
So yeah, because and again, so even though yes, mommy, so when you hear mommy and breast cancer, people just tend to think just women, but then men also get breast cancer, though it's one in
yes,
100. And then, but also remember that every man, I know when I say people are really, yes, every man I know is connected to a woman. Just think of it. You have a colleague, a sister, person who serves your meals or where you eat
everybody
and
is connected.
like to yeah, everybody's connected. So please share, talk about mommy, share it. And
Absolutely. Are
yeah,
you
so
thinking
that
of incorporating, what should I say, a kind of mental health thing to it?
so in terms of mental health support, for now, what we have in mind
I
is
mean, in the
yeah,
future,
yeah, yeah. For now, what we have
not
in mind, because
now.
when I say well, because we actually start making from when we have ideas, we're creating a backlog of ideas, and then we just sort of then prioritize it as I meet with the team, brainstorm, and then prioritize it. So in terms of mental
Yes.
health, because mental health support is key, and so one of the things that we believe that the patient navigators within hospitals can do is also even signpost people to access that support, because some of that support not exists in a lot of places, but some people
Mm-hmm.
don't even know how to access them, and they are looking for clients or people to help to support. But and then so
Exactly.
it's sort of forming that bridge there. And so as we get information on where those support groups are, we'll add it to the app so people based on the states they live in can know what is local to them. And then also to be, I said, so mommy is a breast health education tool, but it's also
Mhm.
like a resource database that where people can access. That's our plan in the future as we deal.
So where do you see
Thank you.
Caparize 5 years from now?
Hmm. Yeah. So what do I
The
see?
larger picture.
Yeah. So
They
the
say if
big
you speak it, it comes alive. So yeah, we're
yeah.
speaking positivity
So
here.
if we speak of Corporize broadly, as a non-profit, as a charity, so Mami is one of the products of
Mm-hmm.
Corporize,
Mm-hmm.
as you know.
Mm-hmm.
So for Mami in particular, I foresee a situation where it would have expanded into 5 countries. Sorry, other African countries, and then even beyond the language. So apart from even the African sub-Saharan Africa, that low-income countries, we're also looking to expand into South Asia and South America, wherever the need is and where we have the similar stats and similar
Underserved,
underserved
communities.
populations, yes. And even in that said, one of the other plans we have for the app is actually then also to adapt it to non-mobile phones. We're already working on that in terms of the design. So I won't go into all the details now because of time, but that's one of our plans because we're really focused on not rather on ensuring that no woman is left behind. And so by providing just for people who use smartphones, that in a sense almost even widens the gap. So our goal is to close that gap. So
Yes.
adapting to non-smartphones is top of our list. And
Mm-hmm.
then in terms of Corporize as a whole, we're really looking at cancer control. We've just started with breast cancer as the first step.
Yes.
And then, in terms of, there's so many issues to be focused, apart from the health education, cancer health education tool, kind of creating that, which we have started with breast cancer, that will go into cervical cancer and other cancers side. Then the next thing will also be, strengthening the health system pathway. So there's also the aspect of, in terms of facilitating development of radiotherapy centers in Nigeria, across African countries, because there's a huge lack of that. And then also contributing our own way to, in terms of research and design, but still, contextual, maximizing resources that exist and stretching that, expanding on that.
Yes, I'm happy that I see Nigeria really spearheading and really, sitting on top of the cancer control
a lot of
agenda
progress is
now.
being made.
Yes. I'm proud that they're doing that right now, because now, if it rains, it won't just rain on my roof, huh? It will rain on everybody's roof.
Rains on everyone. So it's all hands on deck, in my
all
opinion,
hands
and
on
across
deck.
the continuum. So in as much as I know people work on different aspects, and for now,
yes, exactly.
Position at early detection, prevention, end of the. However, every aspect is crucial and is essential, to forge forces and
yes, collaboration and
collaboration is crucial. Is
it's
key.
very crucial, and I keep on saying, we shouldn't work in silos. We should all
work together.
We work together. We have the same agenda. We have the same outcomes that we envisage.
And we go further for longer. It's more sustainable.
Exactly. Could change just one thing about healthcare, what would that be? Just one thing. I know that's difficult.
I would
because we want to change everything.
I can say it in one word. However, that word it's rather broad and it's encompassing. And I'll say
go
access.
ahead, darling.
I'll say access. If I could change one thing, it boils down to access. I know now we've created Mami, we're building on Mami. However, technology, however sophisticated, at the end of the day, is to facilitate what we need at the core, which is that human contact, which is access. What is access to care, access to support, access to finances, infrastructure. So it's, in one word, I would say access to
and access care. It is, and access it is. Yes, that sums everything up. You've hit it in all the right spots. Yes, exactly. Access to care, access to finances, access. In fact, I say equality and equity, because it shouldn't matter whether you have deep pockets or not. You should be entitled to the same care that the haves, are entitled to. Quality care. Absolutely. So, dear Mercy, what is the favorite thing that you'd love to do when you're not busy? What is it how do you unwind? To keep your sanity, how do you unwind?
Okay, it depends on where I am, and then the different, but I do a few things. I like watching TV. I like reading, though these days I spend more time listening to audible books. I'm still trying to convince my daughter is also reading.
That's good.
And then I like trying new recipes. I'm not a chef, but at the same time, it doesn't really matter how it turns out. For me, I just find it relaxing putting things together and from scratch. And so those are the few things I like.
That's wonderful.
I love listening to music too.
Okay, just like me. I love listening to music and dancing, While I was waiting for you, I had my jazz on, to hype me up. I'm a jazz fanatic, Oh my God. So it puts me in that zone,
Oh, nice. I love music.
Thank you so much, Mercy, for coming on. I truly appreciate your kindness.
Thank you, Grace, for having me. It's truly an honor to be here. Really, really. Thank you. And I really enjoyed our conversation.
Me too. And we will have more. We'll be watching and you keep us posted regarding Mami. And we're here. If there's anything you need us to do, to push the word out, to, I have huge resources and just let me know. I'll be a volunteer.
Oh, thank
All
you. That's so
right.
kind. Thank you. Thank you so much. I really appreciate it. And everyone download Mommy. Yeah.
Yes,
Thank you.
don't worry about that. That's going to be in my show notes. Your links, everything. Everybody will
All right.
download Mommy. I'm going to
Thank
share
you.
it everywhere.
Thank you. Thank
Thank
you.
you. So before I let you
Thank you so much.
go, let me
Okay.
sign out. All right. So, my dear audience and friends, there you have it. You've been listening to my amazing guest, Mercy Ofuya, PhD, all across from the pond, who has come to share her insights and wisdom and to talk about her app, mobile app, which helps to make sure that women make healthy and informed choices about their breast health. Please keep the space open. You'll be hearing more from me about this amazing opportunity for you to download her app wherever, on Apple, on Google, and take care of your breast health. And if there are any changes or whatever, you know what to do. And like I always say on this show, make sure to do your medical checks, because until there's a cure, prevention is the cure. Thank you so much for having us on this woman interview series. Bye bye.